Mr. Davis. How are you?
Good, how are you?
Good. My name's Matt, and I'm your doctor here today. So, what can I help you with?
Nice to meet you. I've had some problems with my right foot recently.
Okay.
I just have this pain, and it won't go away. It's about right here.
Okay. So, just right here on the bottom of your foot, kind of
Yep.
this spot in between your toes, right here.
Yep, between these two toes, right
Okay.
here,
All
on
right.
the bottom.
All right. And when did that start?
It started about 6 months ago.
Okay.
Yeah.
And has it just been getting better or worse, or have you noticed any changes in how it's been going?
It's gotten a little worse over time, but what really hurts is during the day.
Okay. So if you had to describe it, right? Describe your pain, right? How would you do that?
I would describe it as it just hurts.
Okay. Just no achy, sharp, anything like
It's
that?
more sharp than achy. It's not
Okay.
like a headache.
Okay.
It's a little more
You can just
located.
You just feel it, right?
Yeah.
Okay. And then does the pain ever travel anywhere?
No,
Okay.
no, it just stays right there. I mean,
Okay.
I keep checking my foot to see if a nail's sticking through it.
Yeah. Is there anything that makes it better? Or anything that makes it worse?
I've been taking some. I've tried Tylenol. I've tried Aleve. Aleve kind of seems to help it more.
Okay.
But yeah, just getting off my feet feels a lot better.
Okay. And what about making it worse?
Just being on my feet throughout the day. The more I use it, the more it hurts.
And when you touch it, it hurts, right?
Yeah,
Okay.
yeah.
Okay. And how bad does it hurt? If you were to rate it on a scale from 1 to 10, what would you say?
At the end of the day, I would say it's probably a 5 out of 10.
5 out of 10?
Mm-hmm.
All right. And is it better in the morning, better at night?
Better in the morning
Better in the morning.
Yeah.
Okay. So
before I'm standing on it.
Okay, so throughout your day it gets a little bit worse.
Yeah.
Okay.
Yeah.
Awesome. So I'm going to ask you some questions about your general health, and that's just going to help me to really understand what we've got going here.
Okay.
So have you ever been hospitalized before?
No,
Okay. Have you ever had a surgery before?
I have had a surgery. I had an inguinal hernia when I was 12.
Okay. Do you have any other childhood illnesses?
No,
What about major adult illnesses? Any kind of chronic illnesses?
no,
Diabetes, hypertension, high cholesterol, anything like that?
nothing like that.
Do you-
Not yet.
Yeah, that's good. That's good. Do you take any medicines regularly?
I take omeprazole for heartburn.
Okay. What about allergies? You allergic to any drugs, foods,
Nope,
anything like that?
Nope.
No allergies? Great. You ever had a blood transfusion?
no.
Okay. What about your emotional state? Would you say that you're pretty a happy, well-adjusted person?
Yeah, I'm happy. I have ups and downs like regular people. But
That's normal. That's
Yeah.
normal. We're just making sure that you're not just chronically down
Yeah, no depression.
or chronically up even.
Yeah.
Okay. What about sleep? Do you get enough sleep at night?
Yeah, I'm trying to get those 8 hours.
Oh, that's good.
Yeah.
That's good. Do you smoke?
No,
Have
never
you-
smoked.
Never smoked.
Never.
Oh, that's awesome. What about your sex life? Are you married?
Yes.
Okay, and you're in a
Sexually active.
and you're in a
Yep.
monogamous relationship.
Yes.
Okay, great. What do you do for work?
I'm a student.
Okay, awesome. And do you find time to exercise as a student?
Yeah, sometimes, a couple times a month.
Yeah.
Not as much
hey,
as I should.
Hey, I know what that's like.
Yeah.
That's tough. What's your diet like? Do you eat
Uh,
student's diet, or you?
Yeah,
get
a little bit
balance?
better. My wife cooks me good meals,
That's
so
good. You getting fruits, vegetables?
Yes.
All
Yep.
You're not gonna be vitamin deficient in anything.
No, I don't
Okay.
think so. Not
Okay.
to my knowledge. I get a
Alright.
pretty good diet.
That's good. Do you do you drink alcohol?
Never.
Okay.
Don't and never have.
Have you ever used any kind of drugs?
No.
Okay. You said you're married.
Yes.
Right? Do you have any pets?
No pets.
Okay. Have you traveled outside of the country recently?
Not recently.
Okay. Good. Now I'm gonna just start the physical portion. So is it
Okay.
alright if I roll up these
Sure.
these
Sure.
pant legs for you here? So what I'm doing is I'm just feeling your legs. I'm feeling for temperature. I'm feeling for lumps, bumps, looking for bruises, anything like that. Anything I see that's out of the ordinary. I'm gonna
Okay.
lift up your leg here. Got to check the underside of this leg and the underside of this leg as well. And then I'm gonna check here. That's gonna feel like I'm pinching you, but what we're just making sure is that your skin snaps back, right? Healthy skin snaps back and doesn't stay pinched
Okay.
like that. Okay. Let me look in between your toes and the tips of your toes here. feet. Okay, looks good. Your toenails seem healthy. Awesome. Okay, now I'm going to check for your blood supply. Okay, so first I'm going to start by just feeling some of the pulses on your feet. I'm feeling one right here on the top of your foot.
Okay.
That's called your dorsalis pedis, and that is a 2 out of 4, which is normal. 2 out of 4 is normal.
Oh, good, good.
And then feeling back here, 2 out of 4 as well. And then if I have you bend your leg,
Okay.
we're gonna feel your pulse right here behind your knee.
Okay.
That's called your popliteal pulse. And you've got 2 out of 4 on this side,
Okay.
and the same on this side, 2 out of 4.
Okay.
You've got good hair growth, which is good. If you don't see hair growth, that means that you don't have good blood supply, but you do.
Okay.
I'm gonna push on the tip of your toes here, and when you've probably seen this before, when you push on your toes or your fingers, it goes white for a second,
Mm-hmm.
and then it goes back to pink. Right?
Okay.
And what that means is that you push the blood out, and the blood comes rushing back in,
Yeah.
and your blood comes back in perfect. So
Okay.
so you're looking good there. Your feet don't feel swollen or anything. They don't look swollen. I can't see that there's any fluid down here. You've never noticed any fluid with this injury, have you?
No. No.
Okay.
I haven't.
All right. Well, let me grab some tools here. There's a couple things we're gonna do to test your nerves. Okay. So the first is that I'm gonna stroke the bottom of your foot like that,
Mm-hmm.
and this is called the Babinski reflex. And
Okay.
what it's supposed it tests for any kind of neurological damage.
Okay.
But you look fine on that.
Okay.
This is the scary part. You pull out the needle, right? No, I'm not actually going to poke you with the needle. It's just
Okay.
going to be really soft. You can feel it, right? It
Yeah.
is a sharp needle, but I'm going to be gentle on the bottom. I'm going to either hit you with this or hit you with this. And
Okay.
you tell me sharp or dull.
Okay.
And if you close your eyes
Okay.
for me.
Sharp. Dull. Sharp. Dull. Sharp. Sharp.
Good. Okay, the other foot.
Okay. Sharp. Dull. Sharp. Dull. Sharp. Sharp. Dull.
Awesome. Everything looks good there.
Okay.
This next part, it's like a little fishing line almost, right? You see that there?
Yeah.
It's not a needle, it's just
Okay.
like fishing line. And so what I do is I put it on the bottom of your foot, and you just tell me when you feel it, okay?
Okay.
Close your eyes.
Okay. Now. 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 Now.
Awesome. Everything looks great with your nerves and your reflexes. If you scoot to the edge of the table for me,
Okay.
I'm gonna. You've seen this before. This is the classic doctor thing to do.
Yes.
And test your reflexes here. Okay, that looks good. Good. And then here at the bottom.
Ooh.
Oh, missed on that one. Alright. Your reflexes look awesome. And if you scoot back for me,
Okay.
there's a couple things that we do now just to test your muscles and stuff. So
Okay.
if you will push against my hands,
Mm-hmm.
I'm going to test your muscle strength.
Okay.
Okay? Great. Great. Awesome. And when I feel your legs, I can see that they're the same temperature. That's
Okay.
good. That's a blood supply thing as well.
Oh, good.
Okay, then we're going to test and see if you have a tight calf. Okay?
Okay.
So don't help me out. I'm going to try to bend your foot up.
Okay.
Okay? All right. You're supposed to get 10 degrees of motion. I don't know if you're getting 10 there, which is really common, right?
Okay.
A lot of people don't get their 10 degrees.
Oh, really?
And so it changes the way you walk a little bit, but it's totally normal, totally fine.
Okay.
So getting back to the real reason you came in. Everything else on your legs and feet looks fine.
Okay.
But getting back to the reason you came in, I think you've got a Morton's neuroma is what it's called.
Okay.
And it's a little problem with your nerve, where the nerve gets some scar tissue on it.
Mm-hmm.
Those bones kind of sit there, they rub, they build up some scar tissue. So what we're gonna do, and that's what you can feel.
Okay.
Right? Is that little piece of scar tissue.
Okay.
So what we're gonna do is we're gonna run next door. We're gonna get you an X-ray and make sure it's not something more serious like a fracture.
Okay.
And once we look at the X-rays and see, then we're gonna give you some more naproxen, right, which is a leaf,
Oh, okay.
and that'll help you out. And then we give you a corticosteroid injection to see if to make after we made sure you don't have a fracture.
Okay.
And if you come back in a week or so, and you let us know how it's going, then you'll be all set.
Okay.
Do
Perfect.
you have any questions for me?
No, that sounds like a good plan.
All right, thank you.
Thank you.